Away from that, the Ghana Health Service says all designated frontline workers at the various health facilities across the country have been paid their allowances. Director General of the Ghana Health Service, Dr. Kuma Aboagye, tells Joy News any frontline worker yet to be paid for work done might be as a result of technical issues with their account details. The Director General's explanation follows threats by members of the Covid-19 task force team at the Cape Coast Teaching Hospital to withdraw their services for non-payment of their 50% basic salary allowance as promised by government since July 2020. Speaking on the sidelines of the commissioning of a Covid-19 center at the Cape Coast Hospital, the Ghana Health Service boss indicated whatever challenges there are would be rectified and the affected persons paid. Richard Kojonyako has more.
Frontline workers at the Cape Coast Teaching Hospital about a fortnight ago threatened to go on strike over the unpaid allowances. They alleged, among other things, that for close to a year, the promise of government to give them 50% of their basic allowances is yet to be fulfilled. Management of the Cape Coast Teaching Hospital had to step in to avert the strike of the medical professionals. But speaking on the sidelines of the commission of a COVID-19 testing center at the Cape Coast Metro Hospital, Director General of the Ghana Health Service, Dr. Kuma Aboagye, was emphatic all designated frontline workers have been paid.
As far as we are concerned, all designated frontline workers have been paid. Those who have not been paid is either because there's an issue, a technical issue, either their account numbers, etc. So all those people who were partly defined, who were actually defined as cost frontline workers have been dealt with. And if there's anybody outstanding, it may be because either we are having issues with the account number or something. That is what is causing a delay. Or they've had a couple of months, 1 or 2 months. Because you see, it is not one person who does the work. So you work in a lab or you work in a COVID ward, but you did 3 months, you leave and someone comes in there. So all those changes makes it much a tedious job to ensure that all those who are moved out are taken off and those who move in are paid for. And that's what caused the initial delay. But I've currently ended last December and nearly almost everybody has been paid.
He assured the region would get a P3 laboratory, a prefabricated lab that's a very high-level support system for the region, so that all the public health reference diseases and other diseases would be attended to. Central Regional Director of Health Services, Dr. Akosia Sapon, said they had to spend funds on transportation to send specimen and get the results of the specimen. She indicated it had implication for clinical decision-making because taking the specimen and receiving the results delayed.
It had implication for cost. We're spending funds in transportation. It also had implications for decision-making, clinical decision-making. And as a region, we made a request to our Director General, and he being so responsive and caring for the people of Central Region and also for the country. He also worked so hard to get us a PCR machine through the donation of NALEX. We needed to put few things in place to ensure that we can use this equipment. And Cape Coast Metro Hospital management to put all the things that we need in place.
Dr. Sapon promised the facility would be put to use to quicken the pace of testing and the receipt of test results. Richard Kojonyako, Joy News, Cape Coast.